Hi, I'm Pat Summerall, and you may recognize me from my NFL broadcast on television. I've been covering professional sports for a lot of years now, and I'm still active today, thanks to the revolutionary world of vision correction. You know, in my job, I had to be able to see the players on the field. I also had stats in front of me at all times, so every angle of vision was important to me. Now, with the Crystalens procedure, I see just as well as I did when I was younger. I'd like to share that with you today and encourage you to ask questions and explore the possibilities of sight with the Crystalens. You'll be happy you did. So let's now take a look at this new technology and see how it works.
Well, thanks, Pat. Hi, I'm Dr. Aker, and I'm glad you're taking the time to learn more about your vision. In this video, we'll discuss how the eye works, how it changes over time, as well as an option available to help you have youthful vision once again.
Whether we're seeing the smiling face of a loved one or a favorite television show, our eyes are our windows to the world. Whether near or far, the young eye can focus on just about any object. But what happens inside the eye to make this possible? As early as the 1930s, Fincham theorized that the eye's natural lens flexes and arches. The purpose of this video is to illustrate this accommodative flexing and arching, which take place in both the natural crystalline lens and in today's accommodative intraocular lenses. As the focus changes from distant to near objects, the ciliary muscles contract, the ciliary fibers slacken, and the crystalline lens becomes more rounded for near vision. This process is known as accommodation. As we get older, however, our eyes lose the ability to accommodate. We may develop cataracts, which cloud the natural lens and can prevent a clear image from forming on the retina.
Today, cataract surgery is one of the safest and most common procedures performed in the U.S. each year. After we remove your cataract, we replace it with an artificial lens called an IOL, or intraocular lens implant. It's important for you to understand that you now have a choice to make regarding the type of lens implant you receive. Standard implants generally provide excellent distance vision, but because they do not move or change shape, you will most likely require glasses to help you read or to work on a computer. But there is another exciting option.
Patients may choose to replace the natural lens with an accommodating intraocular lens. Like the natural lens, the Crystalens creates accommodation from distance to near vision by moving along the visual axis. Both the original crystalline lens and the Crystalens also arch or change their radius of curvature to increase their accommodation. They both move anteriorly and flex or arch to increase their focusing power in the intermediate and near ranges. We can now bridge the generation gap with accommodating lenses. They allow us to restore the near and intermediate vision of our middle adulthood.
Now let's hear what this patient has to say about his own personal experience with the Crystalens.
I was struck the first few days that I was able to actually see out of my right eye after the surgery. Color is now so vivid. I thought I saw blue. I didn't see blue. I must have seen blue. You know, I didn't see green. I saw grow. I'm telling you, it is like it's a whole new world. It is just, intense, you know, and it's so exciting. The choice of lens that went into my eye, I completely trusted the doctor, and he said, here are your options. This is one that I would not go with. Here's the reason why. This is not for you. I believe this is exactly right for you. There was not even a moment of doubt. I started reading every sign in the place. Make sure you wash your hands before touching a patient. Wear gloves at all time. Put toxic waste here. I couldn't believe that I was able to read it clearly without my glasses. I am so grateful that this whole thing exists, that you can do it, the miracle of then having your eye back better than it was when you could see really well, the enjoyment of reading and seeing, and the enjoyment of color. Again, grateful. I would have to say gratitude would be the word, if I had to pick one word.
These happy days are yours and mine. These happy days are yours and mine. Happy days.
Well, I trust that you have found this video to be helpful and informative. I have been implanting this lens since it was approved by the FDA in 2003. I've implanted the Crystalens in members of our staff as well as my own family. Dr. Stuart Cumming, the eye surgeon who invented this exciting lens, traveled from California to have me implant the Crystalens in each of his eyes. I felt privileged and honored to do that. I am happy to say he experienced a wonderful outcome. Like Dr. Cumming, virtually every eye doctor I have operated on has specifically requested the Crystalens. My feelings about the Crystalens can be summed up in a simple statement. If I were about to have cataract surgery myself, the only lens implant I would have is the Crystalens, as I would not want to give up my near vision. The Crystalens basically copies God's design, which is why it works so well. And our staff would all agree that our Crystalens patients are among the happiest patients within our practice. Here at Aker, we are dedicated to helping you achieve the best vision possible. So give some thought to the Crystalens and the possibility of regaining youthful vision. If you have any questions, don't be afraid to ask our staff. We love our work and we're all here to help you. Thanks for watching.